Hi, it's Dr. Brian Taggy. Today we're going to talk about nose bleeding. The term we use in medicine is called epistaxis. Some people get nosebleeds regularly, and this can be a problem for them. First of all, what is a nosebleed and where does it usually occur? There's a little site up inside the nose on what we call the septum. The septum is the middle part of the nose, and just barely inside, there's an area that we've termed Kissel box, where a plexus of capillaries sort of join together. Now, in that area, they can become very superficial. And if there's a vessel that's superficial, excessively superficial, and that's just a variation that some people may have. If it's superficial, they're prone to cracking, especially in dry environments. If you live in a dry environment and you do have these superficial vessels on the nasal septum, then you're going to be more prone to nose bleeding. Now, most nosebleeds occur in that area. If you take blood thinners, then that will further predispose you to more bleeds. And so how do you stop a nosebleed? And I've heard many different variations of how people are stopping nosebleeds out there, and they can be kind of funny sometimes. Things like grabbing your forehead or pinching up high on the nose or putting ice around the neck. But the best way to stop nosebleeds, quite simple. The best way to stop any type of bleeding in the body is direct pressure. Now, the part that is usually bleeding is 1 to 2 centimeters up from the nostril. And that includes the soft part of the nose, or what we call the cartilage part of the nose. And so simple pinching of the lower portion of the nose will stop most minor nose bleeding, even some that are fairly significant. Leaning forward will also help you control some of the bleeding, and it'll prevent some of the blood from going down the back of your throat. And so that's a good position to assume. Sitting down, relaxed, bringing your blood pressure down, because high blood pressure can also predispose you to nosebleeds. Now, if that doesn't do it, then the absolute best way to stop a nosebleed, and I've put a star by it, is to take a cotton ball, and some people have to have their cotton ball and their decongestant, their nasal spray decongestant, in a little Ziploc bag. And if you're having a lot of problems with nosebleeds right now, then that's maybe something you want to do. Saturate the cotton ball with a decongestant, and then putting it up in the nostril that is bleeding is probably the best way to do it. Now, that will stop most nosebleeds. If it's a heavy nosebleed and if you're having difficulty after 10 to 15 minutes, then you may want to consider going to the local Instacare or emergency room. And sometimes they'll use things that they'll put up inside the nose, including tampons or balloon devices that'll stop the bleeding. And so that gives you a good idea of some of the best techniques to stop the nosebleed. In another video, we'll talk about the prevention of nosebleeds in some individuals. And so join me on that one and many others. Make sure you subscribe and like this, and we'll see you next time on the ENT Minute.